Hi, my name is Dr. Osmaan Sheikh, and I'm a MAID provider in BC, and I will be speaking to what the MAID application process looks like in BC. To arrange an assessment for medical assisted death, it's best to talk to the care coordination service in your area, and then they will arrange everything for you. You can also talk to your family doctor or one of the specialists in your care to get the process moving. The care coordination service usually will get back to you within a few days. They will ask you a few questions to get a sense of your timeline. They will also put you in touch with MAID assessors who will likely contact you directly. Anybody really in the circle of care can call the care coordination service to start the process. It doesn't have to be the patient who is seeking MAID, though obviously that person needs to be well informed and involved. If you are currently in the hospital as an inpatient, you can ask pretty much anybody in your care. You could ask one of your nurses to bring the request forward. You can ask your most responsible physician who sees you for daily rounds. Or again, you can contact the care coordination service and go through the same process I described if you were an outpatient. The patient request form and all forms and information that will be required can be found by contacting your care coordination service. They will provide you with all the information that you need. If you'd like to look for it yourself, I would recommend you simply Google medical assistance in dying and the name of your health authority. So for example, Vancouver Island Health Authority, medical assistance in dying. And it will be one of the first links that you see, and all the forms are listed there. The first step in any MAID process is for the patient to complete a written request. This request helps to start the process for MAID so that you can have the assessments that you need. If the patient is unable to sign the form themselves, they can have a proxy sign on their behalf as a witness. The restrictions on the proxy are listed on the form, but basically the person who is the proxy cannot benefit in any way from the death of the patient. So for example, the spouse of a patient who would be in the will would not be allowed to be a proxy. The form also needs to be signed by a witness. This witness, again, must not be in any way benefiting from the death of the patient. It can be a person who is part of the care team, such as a nurse involved with the patient's care. But the witness cannot be one of the assessors or the provider of an assisted death. If you are struggling to find a witness for your form, you can contact Dying with Dignity Canada to arrange for someone in your area to help witness the form for you. After the form is complete, it should be submitted to the care coordination service. They will give you instructions depending on your service of how to submit that form, but likely it will be able to be submitted through fax or email or by dropping the form off. It's always a good idea to keep a copy yourself, but this is not required, as the care coordination service will take an electronic version of the form and add it to your hospital chart. The assessment process for a medically assisted death requires a few steps. firstly, you need to have two separate and independent assessments by two different assessors. Because they need to be independent, they need to be done separately and cannot be combined. The Care Coordination Service will help to set up these assessments. It depends somewhat on the physician or nurse practitioner that you see, but generally speaking, these assessments are done in your home with the physician coming to your house to do the assessment. Some assessments are very straightforward and only take 15 to 30 minutes, but the vast majority do take longer. There are quite a few questions that need to be asked and a lot of exploration that needs to be done around your request and why you're making the request. We also want to be very sure and careful that this is the right decision for you. And so each assessor will meticulously go through all the things that have happened so far with regards to your medical care to make sure that nothing has been missed or there aren't any other avenues that might be appropriate to explore. Most clinicians will ask that part of the assessment be done alone with the patient only. This is because one of the important things that we must determine in an assessment is whether there is any coercion or pressure being placed on a patient to make a request like this. Therefore, it's always helpful to do some of the assessment alone with the patient so they can express any concerns or any issues that they have without family being present to make that perhaps a little more complicated. With regards to the provision of MAID, which is the word that we typically use to describe the act of providing the assisted death, MAID can take place in a number of locations. The most common location is in a patient's home, in their bed, surrounded by their loved ones. The second most common place for MAID to occur is in the hospital, in the bed in the hospital where you have been cared for, or maybe in another room in the same hospital that's a bit more private. That being said, MAID can be provided in other locations. Some people have rented hotel rooms for this purpose because they don't want to die at home and they don't want to die at a hospital. And your MAID provider is the person to talk to about those things. Ultimately, it will be a joint decision between the MAID provider and the patient and the family as to where MAID should occur. But generally speaking, we are all pretty flexible when it comes to considering all these options. At the MAID provision, you can expect the following to occur. Normally, the physician or nurse practitioner will come with a nurse who helps to start the IV. Some clinicians will start their own IV, and they may come alone. Once the IV is inserted, the process is actually quite quick. Medication is injected, which puts the patient to sleep before the actual medication that is required to stop a patient's heart. The procedure, apart from the IV, is painless. There's no concern about a patient having lost control of their bowel or bladder. From start to finish, the injecting of medication takes somewhere between 5 and 10 minutes. During that time, the patient will pass away. After this happens, the MAID provider will confirm death with a few simple tests, and then the nurse will remove the IV. It is quite a simple procedure. It doesn't take very long from start to finish and is very peaceful. Sometimes the provision will take longer if a family has any special requests or rituals or things that they would like to do, and these will always be entertained. The other option for a MAID provision is to ingest a medication orally. This is less common because it provides less control over the timing of the death, but it is certainly an option. It is helpful for patients who would like to be ultimately in control of their death by ingesting the substance themselves. And it can take anywhere from 30 minutes to an hour or two for the medication to take effect. Again, doing this is painless, and there is no concern about patients soiling themselves or losing control of their bowel or bladder. The only issue is that it can cause nausea for some patients, and this is a bit of a concern that your MAID provider will talk to you about beforehand. As you can see from my description of MAID, it's not simple. There are many assessments that need to be done and some coordination that needs to happen to make the provision happen. Therefore, it's helpful and important to start this process as soon as you start to think about it. Your patient request record never expires, and it doesn't have to be acted on. And so you should get in touch with your care coordination service as soon as possible. That will allow your assessors ample time to see you, assess you, and ensure that you qualify. It also makes it much easier in the future to arrange your provision on a timely basis. That being said, most MAID providers have many other jobs or roles that they provide, and we're often not available for emergency provisions within a few hours or even within a day or two. It usually takes us up to about a week to arrange all the things that are required for your assisted death, such as arranging nursing for helping with the IV and arranging medications through a pharmacy. I just want to finally stress how important it is to start this process early and plan appropriately so that you don't miss out on your chance to have an assisted death if that is what's most important to you.